Hello, thank you everyone. It's a pleasure to be here today. My name is Serena Yeung. I'm an assistant professor of biomedical data science. And today I'd like to share some ongoing research discussing how AI can hopefully in the future be routinely used to help augment surgeon training. So I'm a computer scientist by training, and my research group focuses on developing AI and in particular computer vision algorithms to be able to perform automated interpretation of different types of biomedical image and video data, including surgical videos. So I'd like to start off by referring back to a famous study published in the New England Journal of Medicine in 2013 by Birkmeyer et al. And this study asked surgeons to rate the technical skill of their peers based on videos of procedures. And the study found that these ratings correlated with actual patient outcomes. And so I think this highlights the value of the information that's present in surgical videos. However, the study was limited to a small sample size of only 20 videos, and I think this is largely due to the really labor-intensive nature of manual video review. And so I think this naturally leads to the question now, a decade later, of can we develop AI and computer vision techniques to be able to automatically interpret surgeon videos and to extract useful insights from them? And so this is a direction that our research group is tackling and along several different fronts. And so I'd like to share some of that work today. I'll start off by talking about one direction of our work on developing computer vision to be able to measure kinematic characteristics of surgeon movement. So this is work that's together led by my lab members Emmett Goodman and Krishna Patel, together with my co-PI Dr. Gabriel Bratt at Beth Israel Deaconess Medical Center. And so here in this video, you can see our trained computer vision model tracking hand movements and key point trajectories across the video and computing automatic measures of velocity and hand pose change. So now if we look at the hand trajectories extracted for a particular surgical maneuver for an experienced surgeon on top, and a trainee surgeon on the bottom, so it's, I think, already evident to many of you. You can see the difference here, and here, for those who can't see, the red is indicating areas of faster velocity. And so you can see that the experienced surgeon here has more economical movements that you can discern using the computer vision. And so what we did was then use computer vision to extract these kinematic measurements across a cohort of surgeons performing during real surgical procedures. And so here you can see that the computer vision extracted analytics of hand distance traveled is able to differentiate the trainee surgeons, shown by those are the blue squares, with the experienced surgeons, the red triangles. So now if we look at hand pose, we can see sort of a similar phenomenon here. So here I'm showing an experienced surgeon on the left, the trainee on the right. Pose change is plotted across the timelines on the bottom. So here this pose change is essentially an aggregate of the distances between between corresponding key points in consecutive frames. And so you can see that overall the trainee has just much more pose change. And if you look at some of these keyframes, you can start to get a sense of some of the behaviors that cause that to happen. And so again here, it's a little slide issue, but we can see how computer vision is able to extracting this particular features, again, differentiating between trainee and experienced surgeons. And so even these types of computer vision analytics, I think, can already start to be helpful as a type of feedback in surgeons learning to perform, trainees learning to perform basic surgical maneuvers. And so this is something that my collaborator, Dr. Brett, is in the process of designing and piloting how to incorporate these sorts of computer vision analytics in surgical training boot camps at BI. And Dr. Brett is actually one of the speakers in the sessions later today. And so those of you who are interested can find out more there. But in these boot camps, trainees are, for example, given reference videos of particular maneuvers performed by experts and asked to mimic them. And so you can see that we are able to give various types of quantitative feedback to these trainees. Okay, so now moving beyond kinematics analysis, we can also develop computer vision to recognize errors and undesired events in specific procedures. And so I'd like to share an example of our work in this direction for laparoscopic cholecystectomy. And so this is work led by my students Elaine Sui and Josiah Aklilu, and together with my co-PIs Jeff Jopling and Theodore Grancharoff, and also supported by the Welcome Leap Foundation here. And so here we've developed computer vision algorithms that can take a laparoscopic cholecystectomy video as input, and then essentially recognize the key steps occurring in this procedure. So you can see this example timeline on the bottom, and then recognize specific errors that are occurring when they occur and other characteristics. So you can see here an example of of injury to non-target structure or tissue as one example. And here we can see this burn occurring, these white marks here in this particular step. Okay, and then finally, we're also developing algorithms that dive deeper and try to identify associations across large data sets of surgical videos. And so some of these could be used to confirm existing best practices, or some could also be used to help glean new insights that could be used to help improve practice. And so in a recent study, we demonstrated this technique in the context of laparoscopic cholecystectomy. Again, this is work led by my student Josiah Klilu, and together with my co-PI Diana Zaguri, also in collaboration with Eric Sorensen and Intermountain Healthcare. And so here we trained computer vision models to recognize about 150 fine-grained surgeon behaviors for laparoscopic cholecystectomy. These are in the form of instrument, action, instrument, verb, target triplets. And so you can see an example procedural timeline here, and the types of actions that are recognized. And so we use this to basically recognize the actions occurring in 240 laparoscopic cholecystectomy videos from Intermountain Healthcare. And then what we did was basically computed descriptive features based on these computer vision outputs, and then statistically analyzed these for positive or negative correlations, associations with surgeon experience and blood loss. And so here in this work, we just targeted one procedure, but this technique could be applied to many different types of procedures. Okay, so I hope that this gives sort of a brief overview and sense of some of the ongoing directions that we're working on for using AI to analyze surgical videos. And I'd like to just conclude by sort of zooming out and highlighting that I think this is really only the tip of the iceberg of what's possible. And so both within our research group and other colleagues, I think, are exploring various directions in this space. And I hope I've conveyed also the value, the rich information that's present in surgical videos. And I think there's many ongoing efforts to try to increase the curation of large video data sets in surgery. So some of these are laparoscopic that already produce video feeds by default, and in other cases, surgeons are wearing head-mounted or other wearable or overhead mounted cameras. And so I think the data in this space is going to continue to grow. And I think there's many applications possible, both in skill assessment and training, some of which we've discussed today, as well as eventually in sort of the holy grail of also applications that assist with real-time situational awareness. And so with that, I'd like to acknowledge the members of my research group. Thank you for your time, and I'll pass it on to the next speaker.